So today we're going to be doing some exercises and I'll be showcasing you some things you can do for your neck to alleviate some of the pain. However, if you're more interested on how to figure out why there's this neck pain, if you have a curiosity in that, you can go ahead and not only watch the exercises but the explanation after in the video as well. So hopefully you can enjoy both because knowing why will also help you in the future as well. So the first exercise I want to introduce to you is what's called full moon. So for this exercise, you're just going to need some place to lay down as well as a pillow here. So what we're going to do is, let's say I want to work on my thoracic extension just on the right side. So what I'm going to do is I'm going to go side lying on my left side. I'm going to have my left leg straight, right leg bent. And then what I want to do is go ahead, put my left hand on top of my right knee. In this position, I'm going to take my right hand. It's going to come full circle this way. And what I want to be doing is I want to be looking at my thumb with my eyes and follow it with my head. So remember, if it comes up here, I'm looking at it here, coming all the way back, looking at my thumb, and then back around here as well. And once again, going ahead, following my thumb with my eyes, making nice big circles going backwards. So what we're trying to do is promote more thoracic extension, as well as get the shoulder moving as well. Because as we previously mentioned, motion in the scapula is very important. So it just looks like this. And obviously once you did that, you're going to just go ahead, flip to the other side. This time right leg is straight, left leg is bent. This time right hand on left knee. It's going to come on top. Follow your thumb with your eyes. You're going to go ahead and make nice big circles. Try and go nice and slowly, so that you get some good stretching, good motion, opening up the chest, and getting your scapula, your shoulder blade going as well. So do around try and do around 3 sets, 10 times going one direction. And some people ask, should I be going forward as well? Not necessarily. We do like the part where we go externally or going backwards. A lot of people ask us, is it better to go in one direction versus the other? I like to make sure we go backwards because that promotes more the extension of the thoracic spine, as well as bringing your shoulder blade back, as well as opening up your chest. So try and make sure you're going backwards instead of going forwards for your arm circle. For our next exercise, what we want to be doing is we want to set it up so that we're going to be onto our knees. So I'm on this bed right here, but if you don't have one, you can just put a mat on the ground. So just like regular child's pose, we're going to go ahead onto our knees. And we're going to sit back onto our heels. And we're going to go ahead, have our hands forward just like this, just like regular child's pose. So for this exercise, since we're going to create a Y shape with our body, we're going to have to open up our arms just like this. Once we're in this position, we're going to go ahead, have our thumbs up. This is the setup position. Once we get into this position, we're going to think about raising our right arm up off the table, back down, left arm up and back down. And we're just going to alternate between the two. This exercise can be pretty difficult if you do have a hard time lifting your arm up because you feel some tightness in your chest or the lats. We want to get some mobility first before trying this. As well, if you feel tension in the neck, we want to make sure we're actually feeling the muscles being worked in the low traps, which will be close to your mid-back instead. So if you feel it in your traps, try and reset yourself, and you can reset it by trying to have your arms a little bit further out, creating a bigger Y. So try that first, see if you can do it, and if not, try and get more mobility in the thoracic spine, and we'll show you how right now. For this exercise, you're just going to need something that's roughly around waist height when you're kneeling. So you can grab a chair, do it on your sofa. I have a treatment table right here, so I'm going to use that. Next, you're also going to need a mat, or you're going to need, let's say, a pillow just to kneel on as well. Next, what you're going to do is you're going to go ahead, open up your arms here, a little bit wider than shoulder width apart. And then you're going to go ahead, have your hands come behind your neck, your fingers interlocked. And once you're in this position, you're going to go ahead, sit back onto your heels, or as far as you can, until you feel a stretch in the back of your arms, as well as the side of your back. Slowly come back forward, and rock back in, and come back out. Obviously, the further that you sit back, more of the stretch you'll feel. Do what you feel comfortable and slowly come back out of it. For our next exercise, what you're going to be needing is a wall. Probably have 4 in your room. You're also going to need 2 towels as well. So the towels are going to be placed right against your forearm and the wall here. And you want to have your arms roughly around shoulder width apart. Now for some people, they might feel like their chest is sinking in. Let's go ahead, push ourselves up with our elbows so that we have a nice curvature to our back. We also want to keep our elbows in and our hands out, sort of like a Y position. While maintaining this position, looking straight forward, we're going to slide our arms up and then slide them back down. Slide them up, slide them back down. While maintaining, looking forward, and keeping that rounded thoracic spine. For this exercise, you're going to need a belt, or you need something that has no give, so like a yoga strap. Don't try and use something with an elastic recoil, so for example a TheraBand or a gym band as well. You want something that is taut and stays taut throughout the exercise. So for this exercise, we're going to go ahead, let's say if we're going to work on our right neck, you're going to put the belt just over the neck right here. I'll say around the middle of the clavicle, so roughly for me here, or middle of your collarbone. And what you're going to do is you're going to use the front hand to grip onto the belt, and the back hand you're going to grip onto the belt as well. If you have a hard time gripping this way, you can grip this way as well. So however you can get a grab of the belt, this might be a little bit easier for some. So what you're going to do is you're going to pull out on this side, you're going to pull down on this side so that you kind of pin that area. Once you pin that area, I'm just going to move this a little bit closer to my collarbone here. Once you pin that area, what you're going to be doing is you're going to tilt your head to the opposite side and then come back. Tilt your head to the opposite side and come back. Many people, what they want to do is they just want to turn and look down, but what we want to be doing is we're just going to look forward and tilt to the side. This exercise is a great way to make sure that the first rib doesn't get elevated when we move our neck. So there you have it. Those are some exercises I recommend for your neck pain. So one of the things that we look for when we look for a posture is what's called upper cross syndrome. What it basically means is that there's a certain pattern in our upper body where there's tightness and where there's weakness, so it kind of creates like an X formation. So let's look at the weakness first. If you look at the picture right here, we're going to have some weakness in our deep neck flexors, so on the front side of our neck, as well as if we go diagonal down, we're going to have some weakness in our serratus as well as our low traps. And that's associated with our shoulder blade, which is also very important for our neck as well. We'll go more into detail about that a little bit later on in the video. And on the flip side, if that's going to be the weakness, the tightness is going to be on the anterior side, our pectorals, so our chest muscles. And if we go diagonal up this time, it's going to be our levator scapula as well as upper traps. So if you can see from the picture, that pattern creates like an X formation, and that's upper cross syndrome. So next what I want to talk about is another very important part about our shoulder complex is our clavicle. Our clavicle is classified as a collarbone, so it's this bone right here on this model. Now if you look at this collarbone, this is for the right shoulder, it's going to be sitting in front of you just like this. Now for most people, what's going to happen is that eventually over time, because of gravity and the weight of our shoulder, the clavicle is going to slowly depress or go down. As you can see, we want this to be higher up and slightly elevated. But over time, because of weakness in our muscles that promote upward rotation aren't firing as they should be, this will slowly become depressed and depressed and depressed just because of the force of gravity. Therefore, as I previously mentioned, some of the muscles that actually control the scapula or the shoulder blade here are necessary to keep your shoulder blade up, providing less stress on the neck muscles. Therefore, muscles like the low trap as well as serratus anterior are actually very important for neck health. Another thing that we want to talk about, not only about the upper cross syndrome, is going to be an elevated first rib. So for most people, they're surprised to know, especially some of the patients that I talk to, is that they don't realize how high their first rib is. When we think of ribs, we either think about a barbecue, ha ha ha, or we're going to think about the ribs that are on our body, which pretty much encompasses our thorax. But most people don't realize the first rib is really close to our neck. It is a part of your neck. What happens is that our first rib can come up higher and higher if we do what's called accessory breathing. What accessory breathing means is that we're not using our thorax and diaphragm, we're actually using our neck muscles to breathe. Now, if you think about it, if you're using the muscles in your neck, what they're doing is they're pulling up every single time you breathe in and then trying to depress down every time you breathe out. But if you breathe in with your neck muscles over and over again and these get tight, it's going to bring up the first rib higher and higher. I'll talk to you quickly about degenerative disc disease. So DDD is associated with the disc that's in between our vertebrae. What happens in between our vertebrae is that these small discs become smaller and smaller over time due to compression and loss of hydration. So when we think of hydration, we do think about drinking water, which is true, which is important. However, these discs get rehydrated by motion. And you may be wondering, how is that possible? How does me moving my neck rehydrate the discs in between my neck? Good question. So when we think about motion, what we're actually doing is we're actually compressing and then actually opening up and relieving the pressure as well so that nutrients, hydration can occur as well. So just think of a sponge. In order to bring in more water, you have to squeeze the sponge, and then the sponge can also reabsorb the water around the area as well. So our discs work in a similar fashion, is that once you compress it and once you relieve the pressure, nutrients and fluid can flow back into the disc. So if you actually have neck pain and DDD, good motion, so not just any motion, good motion is necessary for the discs. As well, having good alignment will cause less pressure in the area, which also relieves some of the pain as well, especially if you have a lot of pressure in the facet joints as well. Because if you notice, if these discs get smaller and smaller, there'll be more pressure on the posterior side on our facet joints. And our facet joints are just joints that attach one vertebrae to the next. So that's a quick intro to DDD and how we can help. So we looked at degenerative disc disease and we wondered why would that be important, because if you think about it, if the space in between the vertebrae gets smaller and smaller and smaller, what's going to happen is that the space in our intervertebral foramen, which is a hole that's in between two vertebrae, are going to get smaller and smaller and smaller as well. And if you think about it, if that gets smaller and smaller and smaller as well, what's going to happen is that the nerve that passes through it is going to get compressed more and more and more. So the other thing that we talked about with our neck pain is what's peripheral nerve pain. So peripheral nerve pain is the numbness, tingling, or the sharp shooting pain that you may get down your arm. Usually it's down your arm. So we want to talk what we can do about it as well. So one of the things I do like to advise my patients to do is what's called nerve flossing. So nerves are not like muscles, tendons. They don't have any give, meaning that they don't stretch and they don't shrink back to their original size. So if that's the case, we have to make sure that these nerves are able to slide or glide back and forth in our body nice and smoothly. If any irritation does occur, that's when we get the numbness, tingling, or the sharp pain. So the first nerve glide I want to introduce to you is what's called a median nerve glide. So what that glide is for people that are having any type of irritation coming from the neck, and if it's going all the way down to your first three fingers, so your thumb, index, middle finger. So for this nerve glide, what I want you to do is having your elbow up, wrist bent, touching your shoulder. And what you're going to do is you're going to extend your elbow, you're going to extend your wrist slowly, trying to bring your fingers down to the floor. However, if you feel tension, tilt your head this way. And once the wrist comes up, elbow comes up, the head goes in the opposite direction. So we previously mentioned that nerves don't stretch, and if they don't stretch, we want to make sure that they glide. So in this case, what we want to make sure is that if we go in the opposite direction, what you're actually doing is stretching the nerve, which can irritate it more. So remember, when the hand goes away, the head goes towards. So kind of like a windshield wiper effect, just back and forth. So the next one that I want to introduce to you, what's called an ulnar nerve glide. So you can tell if you have ulnar nerve irritation, if you're having any type of issues going from the neck all the way down to your pinky. So a lot of people notice tension in that area. So for this one, what I want you to do is you're going to pretend you're a waiter. So you're going to be holding a plate. And then what you're going to be doing is you're going to bring your elbow up to the side, rotate our hand, trying to get our pinky towards our ear. So if you notice any type of tension building up, remember, tilt close to your hand. And then once this drops, turning around again, head comes back. Up here, tilt towards, head goes away or comes back. And we want to repeat this multiple times so that the ulnar nerve has a smooth glide to it. So if you found that video really helpful, remember to like it, share it. Also subscribe to the channel for more great information on how to take care of your overall health. We at Funcphysio do want to help you get the best life possible, not only physically, but also in all aspects. So hopefully this will contribute to not only your neck pain, but also to overall health as well. So this is Junior Hada from Funk Physiotherapy. I'll see you in the next video.